Welcome to this month's edition of Focus on Health. I'm your host, Dr. Barbara Brookmeyer, and today we'll be talking about substance abuse treatment services available in the Adult Detention Center here in Frederick County. And our special guest is David Brooks, a clinical supervisor. David, welcome and thank you for joining us.
Thank you for having me.
All right. Well, can you tell us a little bit about the treatment services available in the Adult Detention Center?
Yes, we have a male and a female treatment in the substance abuse in the detention center. We have a 24-bed unit in the male unit, and we provide treatment for them on the block. And sometimes we go off of the current block to additional offices and classrooms. The female unit is probably roughly about 10 to 12, and we usually take all of the women into a separate classroom to hold all of our classes.
Okay, so you've got capacity right now, so it sounds like 24 beds for the male unit and for the female 10 to 12.
Yeah.
Is there a wait list right now for services?
Yes, right now we are roughly looking at probably about a month to probably about a month and a half to 2 months, usually about a month to 2 months. Right now we're probably on the male unit, we probably have a waiting list of about 40. Female waiting list, we're looking at right about 10 to 12 right now. And the reason why we do have the waiting list is because there's so many people signing up, and since we just implemented a new 16-week curriculum that really took four of the top evidence-based curriculums in the national circuit and kind of squished them all together and made it into a 16-week program. With that, we have extended it out from a 90-day program to roughly about a 120-day program. So it's making people have to wait a little longer, but we could see that the results are a little better for when people are released from detention center, that they've gotten all the information that they need to know to really have a sustainable
Like recovery, I guess.
Recovery, yeah, when they get released.
Wow, because you already had a really good recidivism rate. I know I've been tracking the numbers for at least the last 6 years or so, and that your recidivism rate for people who participate in the treatment program in the detention center, in your treatment program, is somewhere around 10% versus 55% for the overall detention center population. That does include
correct.
Your population. So you've had great results all along, but it'll be really exciting to see now that you've developed and worked on the evidence-based program and making a little bit longer, but with much more promising results, and it's hard to imagine you can get much better, but that sounds great. So you talked about to get people ready for release and for recovery. Can you talk a little bit about some of what you're doing in that area to help improve people's outcomes after release?
Yeah, right now, what's been really happening is a lot of the judges and a lot of the people have been noticing in drug court are noticing the outcome measure. Like you said, the recidivism rate has been really good. So they've been sending people to have sanctions. Some of the judges have been sending clients, instead of doing 8505s, 8507, to just come to the detention center to finish out their treatment, and before being released to get modified, their sentence to be modified for release. So with that, we've had to really up our standards in our aftercare program, because we don't want people to leave the treatment program without a structured plan of being released. So with that, we're looking for housing for people to go into, to halfway houses, to three-quarter houses, and then also we're really trying to, since our opiate use is right now at an optimal level, that we really try to attack it with the defense mechanism of really being preventative instead of reactionary. So with that, we've kind of started implementing different types of medications that would help with our aftercare plan to kind of solidify a plan that would then get them to so that we can get them to a better place to then meet with their treatment providers, meet with mental health, get doctor appointment, because we've noticed that a lot of people usually overdose within the first month of being released from the detention center.
So that first month sounds really critical, and so is that why the sheriff and the detention center warden and you were looking at the Vivitrol program, that medicine Vivitrol? Can you talk a little bit about why all of you felt that it was important to make Vivitrol available for folks who are being released from the detention center?
Yes, we used to, a couple of years back, we used to give methadone to a couple of the clients that were in the detention center. That program was removed, but here lately we've been really trying to find an effective way to help people when they're released. So with conjunction with the state awarded our detention center, Frederick Detention Center, with a $50,000 grant that was going to help us provide injections of Vivitrol. And right now what's happening is that they've mandated for you to have been in treatment or to have completed treatment or ongoing treatment while in the detention center. Then you will receive a shot that will be grant funded, and then when they are released, and it gives them, before I say that, Vivitrol gives you about a 30-day window where you that it would block any type of opiates that would be trying to be used during that period of time. So this will give them a time where they won't have to fight cravings, where they won't have that fear of overdose, and then hopefully if they even relapse and use, they won't feel the effects of it. So it kind of gives us that opening hand to give them a catalyst to be able to see their mental health and their substance abuse treatment providers that can give them the opportunity to really keep their recovery going outside of the jail.
Boy, that's also another exciting adjunct to what you're already doing, and hope that you also see great benefits from that if it's something that sounds like it helps people, gives them that bridge at least for about a month or so
Yes.
that they can focus on their recovery and getting stable the rest of their life, stabilized back in the community.
Yes. Yeah.
So that's great. So before we close, is there anything else that you'd like our viewers to hear and know about?
I think the main thing is that it's never too late. I think that's the main thing, that a lot of people come into detention centers. A lot of the times they've alienated themselves. They've pushed their family members away. They've stole from their families. They've done all types of things to their family members. But one thing that I can say is that just because they come to jail, they're going to get treated exactly like someone that is coming to treatment that's on the outpatient side. We're going to treat them with respect, we're going to treat them with dignity, and we're going to try to give them all the tools that they need so that they can recoup their whole life back together. So the jail is not the end. It could be the beginning of their recovery and their new life.
Boy, that is great. And I know I've heard the stories from many people who, like you just said, so jail was not the end, it was actually the start of their new life. And I think that's a great way for us to end our interview today.
Thank you very much.
Thank you for joining us.
Thank you for having me.
And now please stay tuned for this month's Medical Myths. Early Hearing Detection and Intervention, or EHDI, programs help children with hearing loss receive the early intervention services they need in order to learn to communicate with their families, teachers, and playmates. EHDI programs start with hearing screening completed before newborns leave the hospital. If this initial newborn screening indicates that there might be a hearing loss, it is recommended that the baby be rescreened at 1 month of age. Hearing loss, however, can continue to develop or begin throughout early childhood. If you or someone you know would like to learn more, contact the Frederick County Health Department at 301-600-1611 or Google Audiology and Frederick County Health Department.
The Frederick County Child Advocacy Center focuses on child abuse awareness and prevention. The emphasis is on the importance of preventing child abuse and neglect. The Child Advocacy Center works to help children reach their full potential in a safe and loving environment where they can thrive, develop character, and learn to be responsive citizens. Join us in making a positive difference in the life of a child and bringing a brighter future for Frederick County. For more information, visit www.frederickcountymd.gov/CAC or call us at 301-600-1758.
And now here's this month's Medical Myth. This month's Medical Myths is about weight loss and diet myths from the National Institutes of Health. The first myth is that fad diets will help me lose weight and keep it off. Well, fad diets are not the best way to lose weight and keep it off. The diets are often hard to follow and result in the yo-yo effect when weight is regained. Fad diets may also be unhealthy. They may not provide all the nutrients your body needs, and they can increase your risk of developing gallstones. The second myth is that grain products such as bread, rice, and pasta are fattening and should be avoided by persons trying to lose weight. Well, the truth is there are two types of grains, those that are whole grains and those that have been refined or processed. When grains are processed or refined, they lose beneficial dietary fiber, iron, and many B vitamins. People who eat whole grains as part of a healthy diet may lower their chances of developing some chronic diseases. You should aim for at least half of your grains to be whole grains. Another myth is that low-fat or fat-free means no calories. Well, that is not necessarily true. Such foods may be lower in calories, but some have the same or more calories compared to their full-fat versions. The final myth is that some people can eat whatever they want and still lose weight. Well, the simple truth is that to lose weight, you need to burn more calories than you eat and drink. While some people may seem to be able to get away with eating anything, they still need to use more energy or calories than what they take in through food and drink to lose weight. Research suggests that safe weight loss involves combining a reduced calorie diet with physical activity to lose 1/2 to 2 pounds a week after the first few weeks of weight loss. Make healthy food choices. Eat smaller portions. Build exercise into your daily life. Combine these habits may be a healthy way to lose weight and keep it off. These habits may also lower your chances of developing heart disease, high blood pressure, and type 2 diabetes. That's this month's Medical Myths. And now, here is this month's health tip with Amber Nally.
Hello, this is Amber Nally, health educator with the Frederick County Health Department. This month's health tip is brought to you by the Community Health Services Division. According to the National Institutes of Health, the majority of the 140 million men and women who are employed in the United States spend a significant amount of time each week at their worksite. Wellness programs in the workplace are an effective way to support people's efforts to achieve and maintain a healthy weight. Long periods of sitting or of minimal movement are associated with negative health outcomes. Physical activity fuels the brain, improves mood, and increases productivity. Heart disease, cancer, and stroke, the top 3 causes of premature death, are largely affected by what we eat and how active we are, which can be influenced by supportive practices in the workplace. According to the Centers for Disease Control and Prevention, regular physical activity is one of the most effective disease prevention behaviors. Physical activity programs within the workplace have the ability to reduce feelings of depression, improve stamina and strength, reduce obesity when combined with diet, and can reduce one's risk of premature death. Even if your workplace does not have a formal wellness team or program, there are ways everyone can incorporate exercise into their workday. Some examples include parking further away from the building, taking the stairs instead of the elevator, creating an office walking club, or setting a reminder on your calendar that alarms you when you've been sitting for over an hour. For more information regarding the importance of exercise and fitting it into your workday, please see the CDC's physical activity page. Thank you for tuning in to this month's health tip.
And thank you for joining us for this month's edition of Focus on Health. Please join us next month.